So for okay, I have patient Miriam Adib. They are birth is 7 January 1968. The patient had ordered morphine for her surgery risk factor. Now I come to my patient. Good afternoon, Miss Miriam Adib. How are you?
Thank you.
Yeah. I just read the medical order and then saw the doctor order morphine for your risk factor. Which is very painful. The dose is 50 milligram morphine via PCA machine. So I'm going to give the drug to you. But before I give it to you, can I confirm your details to make sure I have the right patient? Can you tell me your full name, please?
Mariam Antit.
Your date of birth?
7th of January 1969.
Okay. Can I look your armband to check your medical record number?
Sure.
Your medical record number is 1749631704963. Okay, all correct. And do you have any allergy?
No.
No. Okay. It's good. So can I check your cannula? Do you feel any pain in your cannula side?
No.
No. It's no bleeding, no redness, no side infection. Okay, it's good. And it's just connect this morning. All right. It's all good. All right. Mr. Amira, now I going to collect your equipment, but before I go, can I access your pen level? Can you tell me how your pen now with the zero, no pen and pen is very painful?
Let's say 8.
That's too much. Okay, thank you very much. I will go back very soon. In the meantime, if you have anything, hear the buzzer. Wait the buzzer, I will come to you very shortly. Can you be second line to do my validate order?
Yes, sure.
Yeah, I have patient Marina Deep, MRI number 174963, and their birth is 7 January 1969, and I already checked everything. I have the correct patient, and my patient have no new allergy with the signed by the doctor, and the doctor ordered morphine for her risk factor surgery, and the dose is 50 milligram per 50 ml, which is the concentration is 1 milligram per ml, and the number of syringe is 3, and PCA dose is 1 milligram per push, and lockout interval is 5 minutes, and facial infusion is 0 milligram, and the hourly dose limit is 12 milligram, and the drug is due today, which has been not given yet, and it had been signed by the doctor.
Yep.
Are you agree?
Yeah.
Okay. And I'm going to get my morphine in the SA copper. Before I so for the morphine, because it's a SA drug, so I should check the balance to make sure it's the right one.
Yep.
Here in the book we have the 18 of morphine vial left, so I count it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. 18 correct? Alright. And now I have the order is for my patient Miriam Adib. The order is morphine for her risk factor. And the dose is 50 milligram per 50 ml. One vial is equal with 10 milligram per 2 ml. That means I should get 5 vial. 5 vial equal with 50 milligram per 10 ml. And then I count for the balance. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So I get 13. I had 13 left, and then I write here. Today 15, 17. I basically amount is 50 milligram. The balance is 13. We already count 13. My name is okay, here we have 13 left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 13 left. I'm sorry, I forgot to mention the day expiry is 2020, which is still valid. Can you be second line to do the first drug check with me, please? Here I have a patient. Her name is Miriam Adib. The MRI number is 174963, and I already confirmed her detail with her armband. And then I have the right patient. My patient has no new allergy, and then it has been signed by the medical officer. The drug order for my patient is morphine. The dose is 50 milligram per 50 ml, and the route is IV intravenously. Here what I got, I have 5 vials of morphine, which is 1 vial it contains 10 milligram per 2 ml. He have 1, 2, 3, 4, 5 vials of morphine. Morphine sulfate 10 milligram per 2 ml is Friday 2020. Morphine 10 milligram per 2 ml is Friday 2020. Morphine 10 milligram per 2 ml is Friday 2020. Morphine 10 milligram per 2 ml is Friday 2020. Morphine 10 milligram per 2 ml is Friday 2020. So that's means 5 vials. I have totally 50 milligram per 10 ml. So to make up 50 milligram per 50 ml, I have 4 vials of normal saline, with 1 vial is content of 10 ml. 1, 2, 3, 4 vials of normal saline, 10 ml. Expiry 2018. Normal saline 10 ml. Expiry 2018. Normal saline 10 ml. Expiry 2018. Normal saline 10 ml. Expiry 2018. And the drug is been due now, and no syringe have been given yet. And now I am going to draw my drug. Do you agree with the first drug? Yes. Thank you. Okay. So now I going to draw up my drug.
So now let's go to the patient. So we set it up according to the office order. So here we use information, yes. So we have the drug morphine. Drug concentration is 1 milligram per ml. PCA dose is 1 milligram. Lockout period is 5 minutes. Occlusion level, there's no consideration for that. So we leave it like that. It's not continuous. Loading dose is 0. Maximum limit is it says here 60, so we have to alter it. Milligrams and yes, are you happy with that? Yeah. Alright, so we just need to confirm the identity of the patient again. So hi, Miss Edith, you're back. Before we commence the medication, can I just confirm your details again? Okay, thank you. Could you please state your name and your date of birth, please? Yeah, so your full name? Yep,
Here I have 40 mil normal saline.
You agree?
We check the MRN number. She has no known allergies. The drug is morphine here. And we've used morphine 5 vials. Expiration date 10/20, 10/20, 10/20, 10/20, 10/20. And we've used it with saline, which is here. Normal saline. Expiration date of 2017. September. Yeah. That. So morphine 50 milligrams. Syringe. Concentration is 1 milligram per mil. Number of syringes is 3. PCA dose is 1 milligram. Blood oxygen is 5 minutes, sorry. Basal infusion is 0. Maximum dose limit is 12. Which says here. And as a doctor, it has that.
So before we give the medication, we need to do our blood drug check. Would you mind helping me do the blood drug check? Here's the patient, Maria Adip. We correct the person that correct patient label. She doesn't have any allergy, and the doctor have ordered morphine 15 milligrams every 15 minutes. And signed by the doctor. The order is today's date. It's PCA. So the concentration
Before I connect the
1
line,
milligram every meal. Number of
check the
syringes
ice pipe again. So I'm happy to do this because it's not red, it's not bullet. So, yeah. So Miriam, I just need to leave this
milligram every hour.
using
Already
alcohol.
this limit is 12 milligram. And signed by the doctor already. And here's our medication, 50 milligram together. We use normoxanil and use our medication, morphine, 10 milligram every 2 meal, and it's not expired. Good.
Yeah, I'm gonna do that. I'll connect it today. So just to confirm again,
Okay.
morphine 1 milligram per mil, PCA dose 1 milligram, lockout period 5 minutes.
Now I do my
Loading
drug
0,
label.
dose limit 12 milligrams. And
Patient name is Miriam Adip. Miriam Adip. Miriam
so
Adip. The ID 1749663. They are 47
I've
1
commenced the PCA for you.
69
Now,
and medicine in morphine.
okay, so you see a bright green light
The
here.
amount is 50 milligram.
But there's a lockout period of 5 minutes. So
In 50 mil normal saline. So that means the concentration is 1 milligram
get over the
per mil.
So if the light is flashing, it
The dilution is normal saline.
the drug is administered to you and given to you.
0.9%. Today 15 March 17. The time is 15. And it prepared by mice. Can you see? If you happy, can you sign for me?
And if you feel morphine will give you some adverse reactions, such as you can feel nauseous or you can be constipated or even drowsy, please let us know because we have medications for you to be started by the doctor. So yeah, everything
Okay.
will be
Can you be the second hand to do my second drug check, please? Here I have IV narcotic analgesia drug. My patient name is Miriam Adip. MRN number 1749663. And I already confirmed my patient detail with her armband, and then I have a right patient. My patient have no new allergy, and it has been signed by the medical officer. The doctor ordered morphine for her refractor. The dose is 50 milligram per 50 mil, and the route is IV intravenously. Here I got morphine sulfate 5 vial. 1 vial is contain of 10 milligram per 2 mil. 1, 2, 3, 4, 5, 50 milligram. Morphine 10 milligram per 2 mil. Expiry 2020. Morphine 10 milligram per 2 mil. Expiry 2020. Morphine 10 milligram per 2 mil. Expiry 2020. Morphine sulfate 10 milligram per 2 mil. Expiry 2020. And morphine 10 milligram per 2 mil is brother 2020. So totally I have 50 milligram of morphine per 10 mil, 2 med cup of 50 milligram per 50 mil. Here I have 4 vial of normal saline, 1 vial content of 10 mil. Here normal saline 10 mil is brother 2018. Normal saline 10 mil is brother 2018. Normal saline 10 mil is brother 2018, and normal saline 10 mil is brother 2018. 1, 2, 3, 4. So that's meaning 50 milligram per 50 mil. And here what I draw up, I have 50 mil after I draw up my morphine and my normal saline. Do you agree with that?
Yeah.
And the drug is due now, and is no syringe have been given yet. And now I'm going to set up the syringe into the PCA machine. Do you agree with that?
Yeah.
Thank you. Can I stay with you about the purpose of the morphine? Because I didn't mention in the validate order, so I should mention now. The morphine is the narcotic pain reliever, and it's used for the moderate or the severe pain. My patient have surgery risk factor, which is very painful. That's why the doctor ordered morphine for her. And the adverse reaction of morphine is my patient some might feel hypotension, drowsy, confused, nausea, vomiting, or sometimes have respiratory depression. And I already accept my patient history. My patient haven't got any history of respiratory distress or asthma something. And the dose of morphine is 50 milligram per 50 mil normal saline. And it's intravenously, and it's given by PCA machine. And the nursing consideration for the patient is after we give the patient the drug, we must monitor patient slowly about the mental state, and we record every 1 hour vital sign for the first 8 hours, and after that second hourly until the drug finish. And I already record my patient vital sign at the baseline before I give my patient the morphine.
Yep.
Now I'm going to connect that one to the machine. Now I'm going to set up the machine. Okay, this is for the new patient. Yes, for the new patient. Confirm new patient. We confirm the protocol. Protocol is for morphine. For morphine, we have morphine. The dose is 50 milligram per 50 mil. That means concentration is 1 milligram per mil. Here 1 milligram per mil, and the PCA dose is 1 milligram per push. The dose is 1 milligram per push, and lockout interval is 5 minutes. And lockout interval is 5 minutes. And patient infusion is 0. The patient infusion is 0, and the maximum dose per hour is 12 milligram. 12 milligram per hour maximum. Okay. So I confirm that. Okay, I confirm. You'll be second and to do the third drug check with me, please. Here, I have an IV narcotic analgesia drug, and my patient name is Miriam Adib, MRN number 174963, and I already confirmed my patient detail with her armband, and I have the right patient. My patient have no new allergy, and it has been signed by the medical officer, and the doctor ordered morphine intravenously for her. The dose is 50 milligram per 50 mil. And here what I got, I got 5 vials of morphine. One vial of content 10 milligram of 2 mil. 1, 2, 3, 4, 5. Morphine 10 milligram per 2 mil expiry 2020. Morphine 10 milligram per 2 mil expiry 2020. Morphine 10 milligram per 2 mil expiry 2020. Morphine 10 milligram per 2 mil expiry 2020, and morphine 10 milligram per 2 mil expiry 2020. So that means I have 50 milligram per 10 mil. A 2 med cup of 50 milligram per 50 mil. I have 4 vials of normal saline. 1 vial content of 10 mil. Here 1, 2, 3, 4 normal saline 10 mil expiry 2018. So normal saline 10 mil expiry 2018. Normal saline expiry 2018 10 mil. Normal saline 10 mil expiry 2018. So after I draw up, I have 50 milligram per 50 mil, and I already set up in the PCA machine. And the drug is due now, and it's no syringe have been given yet. And I go to my patient to do the second patient check. Do you agree with the third drug check? Oh, thank you. Hello, Miss Miriam Adib. I come back with your medication. I already prepared for you, but before I give it to you, I would like to confirm again your detail to make sure I have the right patient. Could you tell me your date of birth and full name, please?
Maria Medjib,
Date of birth?
7 of January 1969.
All right. Can I check your armband? Make sure. 174963, 174963. Okay, correct medical record number. Do you have any allergy?
No.
All right. Miss Miriam Adib, I would like to explain something to you, but before this, I would like to explain something for you. When I give the drug for you, the morphine is the pain relief. The doctor order morphine for you because of your risk factor, very painful, and the adverse reaction of the morphine is sometimes you feel it dizzy, you feel it confused, or you can feel it nausea, vomiting, or difficult to breathe. To breathe. So if you feel, in the meantime, if you feel anything of that, can you please get the buzzer? I will come to you and check on you. And for the machine is set up already every 5 minutes. The drug will come up in here. If you see the light. If you see the light on, that means the drug already for you. But they set exactly 5 minutes per push, and the dose is a very small dose, which is 1 milligram. So you can push the button when you feel the pain. But it's only 5 minutes. You can put too much. It already set up every 5 minutes. So now I go in to connect the drug to your cannula.
Giving the dose by yourself. Anyway, I'll just check on your identity. So if you can just state your name and full name and date of birth, please.
Miriam Medjib,
Do you have any allergies? Okay, MRN number 1749. I will be taking your baseline levels just make sure that everything is everything relaxed and you can commence on more. Is that alright? Okay. Before I order, after taking the vital signs, I'll be documenting it on the chart. Okay, Miriam, I've done a set of photos for you. I'll come back in a while to take about 10 minutes to prepare your medication.
Okay, now I'm going to tap that one to circle the light for you.
Just press and come right to you to attend it. Alright?
Start.
So
Okay, the machine already start.
validate the order.
Already start, but the drug will come up after 5 minutes. So when you see the light start, you can wait the light. Now I'm going to dispose my medication, and then I will come back to you after 50 minutes to check on you. So in the meantime, if you feel any uncomfortable and you get the buzzer, I will come to you and then I check on you. Thank you. So now I'm going to documentation my medication chart. The time they given drug is
Wash my hands. I'd like to
15. It's my senator. It's your senator.
date of birth is the 7th of June.
Okay. I dispose my equipment. Okay, done.